Continuing further with our series of pediatric dental anatomy, in this video we will be discussing about the dental anatomy of primary mandibular canine. Watch the video till the end to understand it well. Hi, we at DentoRise welcome you all to a platform where we help you to conceptualize, visualize and memorize dentistry. According to the FDI tooth notation system, the left primary mandibular canine is numbered as 7-3 and the right primary mandibular canine is numbered as 8-3. Primary mandibular canine has features very much similar to that of primary maxillary canine with certain differences between the two teeth. So we will be discussing the dental anatomy of this tooth, differentiating it with that of the primary maxillary canine under 4 headings: the labial aspect, the lingual aspect, the proximal aspects and the incisal aspect. Coming to the labial aspect, first of all talking about the dimensions. The length of the crown cervico-incisally is 6 mm. The length of the root is 11.5 mm. If we compare these dimensions with the dimensions of primary maxillary canine, then you can see that the crown is perhaps 0.5 mm shorter in a primary mandibular canine and the root is at least 2 mm shorter in a primary mandibular canine. Comparing it with that of the primary maxillary canine, you can observe the figure. Talking about the mesodistal dimensions of primary mandibular canine, the mesodistal diameter of the crown is 5 mm and the mesodistal diameter of the crown at cervix is 3.7 mm. If we compare these dimensions with the dimensions of primary maxillary canine, then we would conclude that the primary mandibular canine is thicker at the neck of the tooth. Please observe the figure and correlate. The biggest difference between the primary mandibular canine and the primary maxillary canine lies in the mesial and the distal cusp slopes. To recall, in a primary maxillary canine, the mesial cusp slope is longer than that of the distal cusp slope. However, opposite is true in the case of primary mandibular canine, wherein the mesial cusp slope is shorter than that of the distal cusp slope, or we can say the distal cusp slope is longer than that of the mesial cusp slope. You can observe the figure. This arrangement is there to make sure that there is proper intercuspation of teeth during mastication. Talking about the labiolingual dimensions, the labiolingual diameter of the crown is 4.8 mm and the labiolingual diameter of the crown at the cervix is 4.0 mm. If we compare these labiolingual dimensions of a primary mandibular canine with that of the primary maxillary canine, we would conclude that the primary maxillary canine is much larger labiolingually. Please observe the figure. Also, in the primary mandibular canine, the cervical ridges labially as well as lingually are not quite as pronounced as those found on the maxillary canine. You can observe in the figure. So, this was in short the features of primary mandibular canine, differentiating it from that of primary maxillary canine. Hope the content was helpful for you. If you like our content, please do not forget to like, share and subscribe to our channel. Hit the bell icon so that you can get notified whenever we upload any new video. Suggestions are always welcome from your side. Stay tuned, stay safe. Thank you for watching.